fundamental dilemma is the need to treat the cancer, which of course is potentially life-threatening if it's not treated effectively, versus the risk of undertaking the treatment, at a time when the patient may be particularly vulnerable to this severe viral infection. Again, it depends on the specific details of each person's cancer, how extensive it is, what the surgical approach might be, whether there are alternative therapies that can be administered prior to surgery. Phone or telehealth check-ins on off-treatment days rather than coming to the clinic. It might mean going to local laboratories for laboratory testing rather than coming to the cancer center. And there are other things that are being considered and can be done in certain circumstances. In other circumstances, it may be possible to switch from IV chemotherapy to oral chemotherapy, and that still needs to be carefully supervised by the oncologist, but it at least will delay having the patient having to visit the healthcare setting or the cancer center to receive an infusion of chemotherapy. Discussions should be had with the oncologist about whether the chemotherapy should just be interrupted for a period of time, and what the consequences of that might be, depending upon the patient's current status.
You were chronic because he got when he was older. Like that? Yeah, you're good. You're good. That's all done.
Never took place in December. And I said, well, I didn't because I'm watching politics.
So we would advise, and I think other professional organizations have made similar recommendations, that routine cancer screenings be put on hold for right now. If you have a symptom that suggests the possibility that you might have cancer, you do need to see your provider. You do need to have that evaluated in a timely fashion. Generally speaking, we feel that where the decision has been made that the cancer treatment is more necessary in order to help to ensure the best possible outcome for the patient, then that treatment should go forward.
Computer to report their symptoms as an outpatient, to report any sort of